Hello everyone, my name is Angie. I'm the family nurse practitioner. Today I'm gonna represent my study group, including myself, Angie Nguyen, Esther Chong, Mary Bulega-Kasagga from the University of Massachusetts Global in the DNPU 704 class with instructors Dr.Janet Somlyay. I'm gonna present the topic of statistical versus clinical significance. I'm gonna start with the definitions. In research, statistical significance defined as a measure of the probability of the null hypothesis to be true. The statistical significance calculates a probability using the p-value being less than a pre-specified alpha value. I'm going to give a quick example. If the researcher determined the alpha value of the study 0.01, meaning the researcher is willing to be wrong only one time out of 100. Statistical significance should not be the only reason to change clinical practice. Statistically significant results cannot determine the clinical significance of the study. So what about the definition of clinical significance? Clinical significance focuses on individual patient level. There is a very low probability that the findings occur by chance alone when researchers conclude that statistical significance exists. So the critical thinking skill and clinical expertise are needed to interpret researchers' results to see if there is any relevance of the statistical results to clinical practice. Wow, confusing, complicated. I know that's what you're going to say. So how about some examples? So an example of a hypothesis would be taking a new medication lowers at least 10 millimeter of mercury systolic blood pressure compared to the patients not taking the new medications. What about an example of the null hypothesis? There is no significant change in blood pressure whether or not the patient is taking the new medication. And what about an example of the statistical significance for this study? The p-value of the data analysis is less than the pre-specified alpha, which is usually 0.05. The p-value is the probability based on the data assuming the null hypothesis is true. And what about an example of the clinical significance? By rejecting the null hypothesis, the researcher accepts the alternative hypothesis, rejecting idea that there is no difference in systolic blood pressure with the new medication and accepting the alternative that there is a difference, at least 10 millimeter of mercury in systolic blood pressure when taking the new medication. So what is the clinical significance? It would be the 10 millimeter of mercury drop in systolic blood pressure when taking the new medications. I'm gonna go over the importance of statistical significance. When researchers are testing the hypothesis, they do statistical tests by calculating the probability which is p-value compared to the level of significance, which is the alpha value. The level of significance is important because it determines the risk willing to be taken when researchers create the hypothesis. The null hypothesis is rejected if the p-value is less than the alpha value, but accepted if the p-value is greater than the alpha value. A p-value of the alpha value of 0.05 is conventional. When p-value is less than alpha value, this translates that there is a statistical significance, thus a very low probability that the findings occur by chance alone. No matter the statistical conclusion of any study, the readers have to determine whether or not that information has clinical or practical significance. The target audiences can evaluate whether a particular study's results have clinical significance by the use of critical thinking as well as the clinical expertise. While statistical significance is in relation to groups, the clinical significance is more of an individual basis. Thus, the study results are applied in order to determine the clinical significance. Now, what about applied concepts in reviewing literature? While reviewing literature, it's important to pay attention to the statistical significance with preferable result of p-value less than 0.05, as this rejects the null hypothesis. It is also important to note whether or not the research results were clinically significant by involvement of patients and their families. Statistical significance can be used to understand how strongly the result of a study should influence the decisions. Clinical significance can be utilized in the scenarios where even a tiny error would be too costly, such as in the pharmaceutical, psychological, and medical research. Thank you for listening.